Well, October is Dental Hygiene Month, a time to highlight the importance of taking care of your teeth and gums, which help contribute to your overall health. And Denver Health dental teams provide preventative and restorative care to patients of all ages. So joining us, as always, is Dr. Lindsey Fish. So let's jump right in. We know we need to brush our teeth, but how does oral health impact our overall health?
Yeah, so I don't think we always recognize that they are linked. So actually, gum disease in adults is linked to higher rates of heart disease, stroke, and diabetes. We really worry about pregnant women and their oral health because pregnant women with gum disease are more likely to have premature births or low-weight babies. And then what we don't realize is if we don't take care of our mouths now, it's going to be really hard as we get older. And let me just tell you, not being able to have teeth to eat is really tough and affects your health because you can't eat the same amount of things or a variety of things.
Yes, and it is. It's such a. I know my grandma had dentures, and it was a whole journey of her life, and it was not easy. So it's certainly not an easy thing at all. So what are some practical steps that families can take to improve their daily dental health? We know with kids, it can be a little bit tough at times.
Absolutely. So, I mean, some of it we've heard. You need to brush your teeth twice a day for 2 minutes each time with fluoride. We should be flossing or cleaning between our teeth twice a day as well. We need to be seeing the dentist twice a year, no matter what. I know we don't like it, but let's do it.
Yes.
We should change our toothbrushes out every 3 to 6 months or after an illness. And then we were just talking about limiting sugary drinks and snacks because sugar sits in that mouth and just allows that bacteria to grow and cause problems.
Yes. Okay. So how does, we're talking about, kids to grandparents, how does dental health hygiene look different at every age?
Well, the first thing is starting with our infants and toddlers. We actually should be wiping their gums if they're young, and as soon as they get a teeth, start brushing. We recommend kids see a dentist before the age of 1. Childhood and adolescence is about establishing the good routines, the brushing, the flossing, the good dietary routines. That should continue into adulthood, and then, as I mentioned, really important during pregnancy. And then for our older adults, you mentioned it's other things that start coming up besides sort of the normal gum disease or cavities that we think about. But in older adults, we see challenges with dry mouth, teeth wearing down, dentures, these types of things that can make sort of diet more difficult and challenging. So each stage of life really important to sort of be doing the maintenance stuff and checking in with the dentist.
Okay, so what are some key takeaways that we should remember during Dental Hygiene Month?
Well, we say the mouth is the gateway to the body, so oral health is important for your overall health. Prevention is key, so do the brushing and the flossing as well as seeing the dentist. And then, as you mentioned, it really is about comprehensive care and recognizing that, if something's going wrong in the mouth, it could be an indication something's going wrong with the body. So let's work together to keep you healthy.
Yes, you just feel so clean after you do the whole routine. So, and then you have good breath too.
That's right.
Yes, awesome. Well, Dr. Fish, thank you so much as always for being here. We'll see you next week.